Welcome to the Healers Café, the number one show for medical practitioners and holistic healers to have heart to heart conversations about their day to day lives while sharing their expertise for improving your health and wellness. So, welcome to the Healers Cafe. And today I have with me Evan Jarschauer. And let me tell you a little bit about his expertise. He's an internationally recognized expert in providing professional behavioral health intervention services for complex co-occurring disorder cases. He's a licensed psychotherapist, qualified clinical supervisor, master certified addiction professional with international credentials, and a certified intervention professional. So, from boardrooms in the Big Apple to casino floors in Vegas, all the way to the set of Keeping Up with the Kardashians, somewhere on the outskirts of Los Angeles, Evan has conducted hundreds of successful interventions all over the USA in the past 20 years. And he specializes in creating comprehensive intervention solutions that effectively break through seemingly impenetrable walls of resistance, denial, manipulation, and even bureaucratic red tape by focusing on the underlying issues impairing the person and their ability to function independently. Well, I'm not going to keep reading, but I'm really
Okay, good.
I'm really happy that you've taken the time to
Sure.
discuss the subject with our audience. So welcome.
Thank you very much. Thank you, Manon. Thank you for having me.
So I guess let me ask you why or how you personally got interested in this particular field of study. Let's start with that.
Yeah, I think that everybody at one point or another is interested in understanding, how we all operate. Psychology, what makes people tick. And for me, I definitely had a very challenged childhood and went through my own issues of depression, anxiety, addiction, and this line of work seemed to be like it just made sense. It was a calling.
Mhm.
And with that, I then also recognized that I had a very difficult time with being able to sit in a chair with my own attention issues. So, for
Mhm.
that reason, I took my childhood, my questionable decisions and choices as an adolescent, my attention deficit issues, and my natural wanting to understand how the mind operates. And I put it all together. And my work of behavioral health interventions now affords me the opportunity to travel around the country, helping people in crisis, battling mental health issues and co occurring substance abuse issues where they're self medicating, trying to cope with everything and doing it in the field. And for example, you asked me earlier when we first started if I'm in Florida. Yeah, I'm based in Florida, but I'm actually on assignment in Salt Lake City, Utah right now. And that's so I popped open the computer and I'm here with you now. But that's my story in the scope of 180 seconds.
Okay, great. So what are you finding is the biggest addiction problem, or let's say the drug of choice that affects the mental state of a person?
Yeah. So at the end of the day, there's so many different drugs out there. There's so many different classes of drugs. But me and my work, what I'm finding, and this is nationwide, throughout the states,
Mhm.
is that the number one drug of choice that I'm finding that people are using is weed. And interesting enough, I'll give you a quick. You, uh,
Sure.
so nicotine is a stimulant, right? Right. Alcohol is a
The other way, depends on quantity.
Depressant, right? But oftentimes, but people don't really think about, well, what is weed classified as? And at the end of the day, fundamentally, weed has a very strong hallucinogenic quality to it. And so, for people that may have an already pre existing mental health condition, if you're giving them something that has a hallucinogenic qualities, you may be only putting lighter fluid on an already flaming wildfire. And that's what I'm seeing a lot in the country, where people will say, I've got my weed card, it's legal. I got it at the corner store, the Delta 8, the Delta 9. And even people, when you're getting it on the street, that may be laced with fentanyl. At the end of the day, that's what I'm seeing is one of the biggest issues. And I'm not here coming down on weed. It's
Right.
more so that there are people, there's like alcohol. Some people can drink alcohol and they're fine. Some
Yeah.
people drink alcohol and they're not fine. Same thing with weed. So that's what I'm seeing out there in the world.
Okay. And with the weed, it could be the weed itself, but it's also the current time period where it's being laced many times, or is that it's
Yeah,
a key factor?
yeah, absolutely. I mean, so at the end of the day, it's getting easier and easier to buy weed or marijuana or cannabis at a dispensary. It's easier and easier because it becomes more and more legalized and all that. But when people are buying it out on the street, and they're finding that there's a even more powerful high to it, sometimes you might prefer to get it out there. But the reason you're getting that additional high is perhaps because it's got something extra inside it that's giving you that kick. And oftentimes is the case, or in many cases, it could be mixed with any number of substances, one of which may be fentanyl, which of course we all know can kill you.
Yeah. Well, we're seeing that in Vancouver, full on, full blast,
Yeah.
really intense here. And, marijuana has been legal for a while, which, you know, I mean, on my understanding, and I'm no expert on this, so I'm asking a bit your opinion on this. Um, Making something legal doesn't necessarily, it's not the root of the problem per se, because if it's illegal, people who are wanting it will search it, and then they will get sources that are more likely contaminated. At least that's how I see it.
Yeah, that could happen that way for sure. Yeah.
But then, my background, I'm Swiss, and I know in Switzerland they decided to address this whole drug issue by making it available easily for everyone. And this was not marijuana, this was all kinds of drugs.
Yeah.
And my understanding is that the project failed.
Yeah, that's delicate. So, you're looking at measures, fundamentally harm reduction, right? Where rather than have people share needles, right? Rather than take the chance that there's fentanyl in whatever, the hope is that by making it available or making the way to use the substance or access the substance, you kind of take away the criminal, nefarious
Right.
world that surrounds that, and it also takes away a lot of the people having to do things that might cause them to kill themselves or commit crimes and things like that. Unfortunately, however, um, in many cases, you try to fix the problem by using a harm reduction practice like that, but you may actually, unfortunately, by making it easier, it also potentially helps people become greater access, more people using it, more social interaction using those substances, and it sometimes, in some cases, can backfire. And but there's no question that trying to reduce the risks associated with substance abuse is a great idea. It's just that sometimes by providing those substances or providing the needles, or the syringes might, in the longer run, potentially backfire, because you may find more people start to use the substances because it becomes easier access.
Mhm,
No
mhm.
perfect science on this.
Yeah, no, no, seems complicated for sure. So what mental illnesses, because at the beginning of our talk, you mentioned that somebody may have an underlying
Yeah,
mental disposition, which could be triggered by a product who, will increase, let's say, hallucinations or so.
yeah.
So is that the main type of people that you're called to intervene and help the families out, or?
So, yeah. So, for example, let's say you've got somebody who has mood dysregulation.
Mhm,
In other words, they're not able to regulate their mood. So, you might have somebody with bipolar disorder, right? So, 1 minute they're up, 1 minute they're down, 1 minute they're angry, 1 minute they're your best friend. And so, they're trying to potentially use weed to self medicate and
mhm,
to try to regulate. The problem, one of the challenges with that is that if there also happens to be some degree of psychotic features, delusional thinking in conjunction with those mood swings, by using weed, or and there's other drugs as well, like and this is not to say psilocybin is bad, like mushrooms are bad, or weed is bad. However, some people that may already have a pre-existing condition that has some type of delusional component to it, these substances sometimes actually, like I said before, act like lighter fluid, and
mhm.
all you're doing is you're exacerbating the problem by trying to self-medicate and self-regulate with those substances. So bipolar would be one of those conditions. Definitely anxiety or trauma. Those are two of the ones that I see where people are trying to use to get away, to somehow just numb out the emotional pain of what they've gone through. But for those people that just can't use weed or mushrooms or any other substance, just from a like a from a just to calm down, to occasional use, just to take the edge off, if you will, sometimes you'll find that the symptoms are exacerbated by the use of those substances inadvertently.
Right. But it also I mean, it makes me think how we're lacking health professionals or people with the experience of
Yeah.
dealing with this type of, sometimes it's used as a therapy, right? As you probably know, in
Yeah, sure.
many countries, and not so much as a band-aid to hide the emotions, but rather to explore and get through some of this,
Yeah.
so I see that as well. And I think, I mean, I've certainly heard of many cases that have been very helpful using this, but under guidance.
Absolutely.
Yeah.
Absolutely. There's no question that herbal remedies, herbal medicines, I mean, I'm not a herbalist or a homeopathic doctor, and I'm not any of that stuff. But for centuries, millennia,
Yeah.
with societies all over the world, medicinal roots and herbs have been used, right? So I'm not going there at all.
No. Yeah.
But for sure, there are some people that just have a bad reaction
Right.
to those types of
Yeah.
medicinal remedies. And to further your point, it also sometimes goes to who's advocating for whatever the drug or the remedy is, whether it's who's backing the weed legislation,
Yes.
who's backing legislation for legalized MDMA. There's so many geopolitical variables that I try my very best not to get in the mix of, because I'm a counselor at my heart. I'm a counselor. I'm an intervention counselor. So I try to stay away from all that geopolitical turmoil, all
Yeah.
the provincial stuff that goes on in your world. I just try to keep my nose clean and help as many families as I can. That's what I try to do.
And I think that's the best choice because honestly, it's a mess.
Right.
Uh, People not knowing that it could, some of the stuff could be used for good, could be, right? Under the
Yeah.
right circumstances, don't know, and then they're stuck with it. They don't know what their symptoms mean. They freak out, and
Yeah.
their condition is exacerbated. So I see there's so many angles to this. So who typically calls you, or how does it work?
Yeah. So usually a family, loved ones will reach out.
What would your life be like if you were pain free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
And they will say, hi, I have a loved one who is struggling. We're trying to get him some help or her some help. They're not willing to accept help. We've tried every which way to get them help, and we just can't break through. We can't get through. That's usually who's reaching out. It's loved ones, concerned mothers, fathers, cousins, brothers, sisters, stepsons, aunts, uncles, coworkers. That's kind of who's reaching out. But usually it's at the point where, so the people who are trying to get someone some help, they feel that the person has to hit bottom. You've heard that concept, hitting bottom, right?
Yeah.
So there is a counterbalance to that in my world, where in order for a family to bring me in to help, the people that surround that individual, they have to have hit a bottom first. They've got to get to the point where they recognize that the harder that they try, the unfortunately sometimes the further cornered, the more challenging it becomes to get that person to go get some help. And that's where it makes sense to bring me someone like me in as a professional behavioral health interventionist.
I see. Yeah, no, I can understand that dynamic, where you feel like an animal cornered, and
Yeah,
it's for the good, but you're not. Yeah. So what are I mean, no names and no references, but what are maybe a case you could share where you have had that impact both on the family and the person? Um, yeah, maybe a challenging case that has affected you or has given you the motivation to keep going on helping.
yeah. So yeah, look, I don't have any easy.
Easy case.
There are no easy cases because I'm literally walking. You ever see there's this, I don't know if the guy's Canadian or American or whatever, but this older guy, I think he's a French guy, who climbs up buildings with no rope. He just has chalk. And there's like these
What?
walking, these like free climb walking people. They do their, or mountain climbers that only use their hands, chalk. So in many cases, I'm kind of out there. There is no net. I'm in
Mhm.
the field. I'm before the person is seeing the therapist, seeing the psychiatrist in a program, and I'm dealing with some very raw situations, very emotionally engaging situations. So for me, every case is challenging because there's a lot of unknown variables that I tried my very best to manage. I think that though, when you ask the questions that, which cases maybe have the most impact, I think for me, a case in which there are children where my work, and I'm a cog. You know what a cog is? A ball
Yep.
bearing.
Well,
You've
yes.
got this big conveyor belt, right? And it produces some amazing something. But along the way, you got to have these little pellets that are greased to make it roll. I'm like one of those little ball bearings. I feel as though I'm needed because if you take me out of that little conveyor belt, things kind of flop around. So for me, when there's a case where there's a mother or father who is struggling and they're in crisis, and by helping that family or helping that person get on track, agree to accept help, and work towards recovery, and I'm going to use one of, I guess, where you're at, really embrace the concept of interpersonal healing, right? For me, what that does is that really, it's like a karma thing for me,
Mm,
knowing that I may have just given that kid or that child the opportunity to have that amazing, healthy relationship with their parent in the future as the person heals. And that's something in my world that I kind of was deprived of.
mm,
So it is a way for me to kind of feel a certain sense of, even though I may not have been able to get that by my circumstances, I'm going to be able to hopefully help those kids be able to have that healthy relationship with their loved one, with their parents. And the other set of cases are the ones where there is a parent who has some type of terminal illness,
mhm,
and where I'm able to help that mother or father or grandparent be able to see their loved one actually enter into a program and at least get on the road to recovery before they pass. Those are
mhm.
some of the real intense ones.
Wow.
I'm not going to share with you the famous people I work with
Uh,
and the very powerful people I work with. I can't do that. That would be very interesting, but I ain't going to do it. But
yeah,
I
no,
can share with you from an emotional standpoint that that's the kind of stuff for me personally that really makes me feel like, okay, this is a very, very cool job, position, opportunity, career. And so for that reason, I consider myself from a professional standpoint one of the luckiest people out there. I don't feel like I've really gone to work in maybe 20 years,
wow. Yeah, that's definitely a sign of loving what you do. Yeah,
right?
absolutely. And what keeps you, I mean, there must be some times where things don't go well. How
Yeah.
how do you how do you make peace with that for yourself?
Yeah. So I give it everything I got. We look at contingency plans. What do we do here? What do we do here? How does this get handled? So, you know, I, you can't control, you can only control what you can control. Um, you can only go as far as you can go, right? I think, and by the way, I don't know if you realize this yet, but I'm not as smart as a surgeon. Just letting you know that in advance, right? Because surgeons they need to know math, they need to know science, they need to know.
It doesn't make them smarter.
Well, but it definitely means that they know how to do math at least. They know how to calculate stuff. All right. Well, here's the point I'm getting at. I think a good surgeon um, is a surgeon who is able to um, be good at what they do with the blood, with all the stuff that they're looking at, the pain, the suffering. They're able to focus in on helping that person um, being able to keep their heads together under very stressful situations. And so for me, I've definitely evolved or developed the ability to recognize that I'm in a very emotionally charged situation. Bad things can happen, but I have to be able to keep my head together so I can continue to help people moving forward. Otherwise, if I find myself kind of stuck in a case, how am I supposed to help the other families? And how am I supposed to even help that family if I allow myself to get too emotionally connected? So it's a very delicate balance. I have to be caring, compassionate. I have to be connected, but I also have to be very careful that I'm able to maintain a professional perspective on the expectations set and what we're trying to accomplish.
Mhm. No, I agree with what you're saying completely in principle. How do
Stop
you
right there. Okay,
how
good.
the part of the question is, yeah, what does it take to get that? Because it's, I mean, all health professionals who are dealing with, life and death situations have to
Yeah.
learn this. What is this? What is that for you? What is that skill? How would you name it or describe it?
Like I said, I think it is being able to recognize that, you are going to give it everything you got, use all your training, your skills, your interpersonal perspective on the situation, your own understanding, and recognize that you can only go as far as you can go. You can only take a family as far as they're willing to go. Um, and at the end of the day, not everything is within your ability to manage,
Mm,
and being able to accept that. Some people can't accept that. Some people are not willing or unable to accept the fact that they did everything they could possibly do, and feeling as though they're responsible. There has to be a certain way to establish boundaries within yourself. Otherwise, in my line of work at least, how are you supposed to be able to function? And I think that's one of the challenges too in the health services industry, behavioral health services. Burnout, emotional burnout, is so high simply because you see people in crisis and suffering and struggling. It really does take a toll, but being able to carefully put a perspective on your role in helping, because if you burn out, then how are you supposed to help the next
yeah,
family?
yeah.
And how are you supposed to help your family?
Now it's a fine line between what is within your control and what you choose to believe or see
Yes,
as not in your control, and
right.
where that line is you know, is an interesting one, right? I think a lot of health professionals now are going to be asking themselves that very question, with
Yeah,
actions they've done or not done, depending, so it's going to be a very, I mean, I agree with you completely. That's, same with my experience with my patients, especially if they were very sick or in the process of dying, and there may be hope, because I always see hope. There's still a line, but it's e- especially if you're taking an action or you're giving a drug or you're, you know,
yeah,
following a procedure that may be accepted by
yeah,
one government. But, those are lines that we're all going to have to come to terms with that.
absolutely.
It's
Yep.
going to be very interesting times. Anyway, well, do you have a few last words? Our time is actually up, but I'd love you to just conclude um, this talk.
Yeah, I think that I love what you said about having hope, because that's a central crux of my work. Because I'm coming into cases where families feel there is no hope. In many cases, they feel there's no hope. And so I think that having hope is a critical element of really being able to continue to move forward. Because if you give up hope, then there's what are you looking forward to? And so for that reason, I think that's something essential that you got to have and you got to be able to use it in my world, in a solution focused way, not just to have hope, but how are we going to move towards a hopeful outcome. And so with that said, I mean, that's always been my mantra. There is hope, and with a plan of action, with a solid plan of action, you have a opportunity to have a hopeful solution. So that's kind of where I'm at.
Well, thank you very much, Evan Jarschauer, for your time and taking the time while on travel. So I appreciate it. Or on duty, I guess, truthfully.
That's what I'm doing.
All right. Thank you. So this conversation with Evan Jarschauer brings up many points that are relevant also to Bowen therapists and to healthcare practitioners in general. It's based on the idea of, what is our responsibility, but also our inner responsibility. What do we feel we can do? So as he says, he puts his all in it. And I know many practitioners do the same. And then there's also the other part is what is not within our scope. What could happen that is nothing we could have done anything about. And where do we draw that line? And it really makes me, question and also have a lot of empathy for the practitioners and doctors who in the recent 5 years ago, apparent mandates, at least in Canada, where healthcare practitioners really had no choice but to take it or lose their jobs, actually, as many people did. Many doctors left, many nurses left. I think we have massive numbers of people who left the profession because they would not comply with certain things. The thing is that if they stayed and they are part of the people who participated in giving these, I don't want to give too many names in case I get taken off here, but who participated in this mandate, what is their responsibility? Can they say, well, they did all they could, but they had to? Is that, I mean, in Nuremberg trial, that's not good enough. Being told to isn't good enough. But how are practitioners going to live with this reality that people got injured and died as a result of their not saying no? And that's really the question I have, to discuss. And anyone listening this who would like to take this discussion further, feel free to connect with me. I'd love to explore this in depth. Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.